So, hi, my name is Wanda Ortiz. Um, I first got diagnosed with fibroids between 10 and 15 years ago. I started with the bulging of the belly, which started to get a little more. As the years went by, my menstrual cycle started to get heavier and longer, which became concerning. Um, Over time, I had um, started gaining a lot of weight, and I was concerned because I was trying to lose the weight and I was doing the typical things, but it just wasn't effective. Then I started to feel a bulge on my right side. And so when I spoke to my doctor about it, I learned that one of the fibroids had started growing so large that it was starting to protrude. And it was that was what the bulge was. So in 2020, when I was considering doing something about it, the pandemic happened, everything started closing. And so my doctor had also retired that year. So I decided that I really wanted to consider what my options were. And because I had been with my doctor for so many years, I wanted to find a doctor who really understood fibroids, who understood my condition. Um, and I initially wanted to make sure that I got them checked to see how large they had gotten and then find out what my real options were. So, in my research of options and considering everything from natural healing teas to UFE, just full hysterectomies, what a partial hysterectomy was. So I started really looking at my options. And because after getting them looked at and seeing how large they had gotten, I felt that my options were limited to a full hysterectomy, which would be a lot of cutting on my stomach to take them out. I didn't really know that I could do what I was actually ultimately able to do. So I'm really happy about that. So while I was researching, I did come across Innovative Center online. So I clicked on their website, and this was actually even a couple years ago. And I started looking at what the criteria was. I saw they had the LAM procedures. They had all kinds of information on the website, which I was like, oh wow, this is a gem of a website. So I started going through all of their pages, their tabs, their subtabs, reading their articles. I mean, there's just so much information. Then I started cross-referencing that information on other sites just to make sure that I was reading valid info. Um, and so I called and I wanted to see what I needed to do to get an appointment. So that was where I learned that they'll do secondary, uh, uh, like a second opinion after you get your doctors, but I also needed to do an MRI and submit some paperwork. So I said, okay, I'll do that when I can. So then some time went by. I changed jobs, but you have to go through the whole way for your insurance coverage and all that. So once I'd done that, I said, I'll consider my options. And I definitely kept them as my front runner of all of my options. So I spoke to my new doctor, which doesn't do the surgery. But we did discuss that I didn't want a full hysterectomy. So I was considering a UFE. She said I'd be a good candidate for that. I went and scheduled my MRI. And then I said, I know they do that second opinion. So I'm going to send over my information to you guys and see what feedback I get. I was hoping to work with Dr. Paul McCool. So I wasn't sure who I'd get, but that was who I was hoping for. So to ultimately get him, I was just like, oh, this is just fantastic. So I didn't know, based on the size of my fibroids, I had several. These were the size of like grapefruits in there, oranges. I had a few in there. So based on looking up other people's stories, and what their options were, they were limited in what they could do for their surgery. So I just thought I'm probably going to fall in that category and not be able to do one of these more gentler options of easier recoveries, and I'm going to have to just wear the scar. So I reached out and I scheduled my consultation and sent over my information. And then from there, Dr. McCool and I started coming up with a plan for me. I just think the word hysterectomy sounded scary to me. As a little girl, you grow up, you get your period. It wasn't really something we talked about. It wasn't something my mom had. It wasn't anything that I had really known people to experience. I did know a couple people who did it. They seemed to be fine, but I just didn't over pry about why they were okay to do it. I felt like even though I already have a daughter, and I probably don't want to have any more children, but I also felt like there's such a permanence to not being able to have children. So I thought, that was a part of my hesitation, and I felt like that's a part of my feminine identity, and it's not that it means that to other people, but that was kind of how I felt. I felt very sensitive about my womb being. Well, first I thought it would just be finding the right doctor. And then I learned more that OBGYNs are not necessarily surgeons, or that they only do surgeries part-time, and that's not their full-time specialty. I also started learning that a surgeon will, a doctor will often recommend to you the procedures that are within their realm of expertise. And that may not be a full inclusive option for you and your situation. And you might actually be limited to what they feel more comfortable to do on you than what you ultimately have the option to consider. So I started considering, maybe I don't want to just consider the doctor and what their potential is, but I want to look at what all of my options are from the best of the best. So then I started considering surgeons. So I said, okay, so beyond the doctor, let's go to who's going to do this. And I wanted to consider how long have they been doing this? How often do they do these procedures? Are they regular doctors? Are they dedicated to this? How advanced is their knowledge and their skill set in the types of conditions that they're aware of, separate from fibroids? How informed is this doctor about other conditions in the whole lady part womb? And I wasn't biased to gender, that it had to be a female doctor because a female doctor has lady parts. Not necessarily. I wanted to go with who I felt content with in my research, that was going to give me not just, and not even just the knowledge and the skill set, but had the bedside manner, who was going to be compassionate with what I'm dealing with. And despite them doing this procedure maybe 1,000 times or several thousand times, which meets that part of my requirement, are they still capable to be humane and compassionate to me as an individual, not just me as a number and then check me off? You know what I mean? And I really appreciated that I got that with Dr. McCool. I learned with the UFEs is that it's not guaranteed they can come back. And also a lot of what they do is, it's suggested that they may shrink once you go into menopause, but that's not guaranteed. And one thing that deterred me from it is I think that it might be a better option for someone who's much earlier in the phase of fibroids, but because mine had already grown so large, at best, it would just maybe stunt the growth. And that could only be really for a few years. It could always regrow, or more could grow. So the dual port option would eliminate the root cause of the issue, and I wouldn't have to guess where the fibroids might shrink. They just would be removed. And that was a great option for me.
Right.
So I do appreciate the whole staff. Every time I had a question, I called, and everyone treated me, even though they knew my name because I called enough and spoke to people. They were always supportive. Everyone answered the question. There was not one instance where I felt that I was a bother, and I always appreciated everybody's input and the ways they were able to direct me. Once my consultation was scheduled, it was really good because he was able to assess my MRI, give me insight information as to what my options were. He informed me further beyond my own research of what he was capable of. We discussed the full hysterectomy, a partial hysterectomy, just removing the fibroids. We discussed recovery times for each of those options. In addition to, we discussed, in order for him to make a full assessment, that he would also need to do what is called
Cystoscopy. Yeah.
Yes. So we needed to do that so he could further assess. And then we did that. Once we did that, that came back with that I not only had fibroids, but I also had adenomyosis. And so that for me was made me go from considering just removing the fibroids and taking a little bit longer recovery to accepting that removing the uterus would be best, because that's where the root of the adenomyosis is. And, I don't want to just take out the fibroids and then have to go back for another surgery. So that was what I made peace with. And I also appreciate that he didn't just say okay to that. That meant a lot to me. He didn't just say, okay, that's what we'll do. He was like, are you sure? I can do this, I can do that. He let me know even fully further what my options were. And he gave me time to consider what I wanted to do. And I appreciate his patience. His patience. He wasn't trying to just force me to get on the schedule. He has to book this. It wasn't cold at all. And I appreciate that. Fly is what feeds the fibroids. And so that was also reducing my iron drastically. So much so that even before surgery, I was still taking blood work just to make sure my numbers were where they needed to be up until surgery, just to make sure that I would be okay. So, and I appreciate him even doing that much follow-up right to the very end, making sure everything is what it needs to be, that I would have the best chance for successful surgery. I prayed a little longer than usual. I prayed for my doctor and the staff, of course. I was very anxious to an extent. I'd never had major surgery before, then going to the hospital, learning that I would be intubated or catheterized. And I'm like, what? But it all worked out really well. But I was very nervous. I got there and I tried to stay in good spirits, because I do have a lot of faith in my spirituality. And I just trusted that everything was going to be fine and I was in proper alignment. But your nerves are still your nerves, So, like I'm sure many women do before going into a surgery of sorts, or so many things in life, we might Google a video or two on a social media platform or two to see what other people's experiences are. Just, of course, everybody has their own experience, but just to see what we could glean from their experiences that we might potentially have to prepare ourselves for. And so, in doing so much research of what other people had been through, um, a lot of them went through a lot of side effects, a lot of things that were very alarming, which contributed to my anxiety the day of my surgery, because I'm like, sometimes you go to a doctor to get something fixed, you come back with something else broken. So, I was like, But based on all of what I had read about the dual port and how he goes about it with his process, and it's almost like a roadmap he uses so that he can avoid certain incidences with organs or the bladder areas or things like that, that other stories I've heard were very traumatic just in hearing, let alone them experiencing. And I learned about people doing the 5-port, 4-port, all these other different, having been cut up and down the abdomen, all their different levels of scarring, and just seeing how clean the dual port can be, just going in through the belly button, a small incision in your bikini line, similar to what is done for a C-section. Just sound almost too good to be true, but I really trusted he could do it. I was like, no, he's legit. I looked up everything. I checked all the doctor websites for their ratings to make sure he was legit. So I said, if it's possible for me to do with my very large fibroids, I would love that to be a consideration. And so once we decided to go with the partial for me, because of my age, that I wasn't fully ready to experience menopause, and the option was really just clearing out the adenomyosis. Everything else didn't have to go for me. And once we confirmed that it wasn't cancerous, which you don't want to spread the cancer, and he did that check as well. Then, and he's also an expert in that side of things as well, which I appreciate. That we were good to go, and I was like, let's do the dual port. And especially my recovery, I would say the first week was a doozy, right? But past the first week, I'm like, are you kidding me? Like this, I'm able to take care of myself, cook, clean, everything, and I feel tons better. I think if more women knew that this was an option, a very realistic option, regardless of the size of your fibroids, I can't see them not wanting to take this approach. And even doctors who do the surgery, if they could consider it not just being about their limitations or wanting to do the surgery, but be able to refer their patients with the consideration of this, their patients would probably be more loyal to them just because it was such a great referral. That's how much I feel appreciative that I was exposed to this option, and no other website, no other doctor, no other research showed me this option. It made me nothing to no one but myself. I have not worn compression socks since my surgery. And before, my legs would get swollen, my fingers would get swollen. But since surgery, my blood circulation, that might not seem much to somebody, feels incredible to me. I can definitely tell my energy levels are coming back up. I've always had a strong bladder. I played sports, and it was always really good. I didn't know, it could get any better. But ironically, my bladder is really, really good and healthy and strong. And I'm like, oh, wow. So just things that may not mean much to other people, that I'm just feeling so much internal changes. I get up and I go for walks now. I definitely go for much longer walks than I was doing before surgery. One thing that I didn't realize I missed so much, that again might not seem like a big deal, was being able to bend over and tie my shoes, because that bulge on one side, on my right side, it was so hard, that it almost like if you're pregnant trying to bend over and tie your shoe, you have to, a big solid thing there. So to not have it there, and it's still squishy. It's there, but it's like it has this other tummy, but it's squishy now, and I can definitely, bend over and tie my shoe. I don't have to feel like I'm holding my breath. So I feel like I breathe better. And some of the bulge was up near the top of my rib cage, and that has lowered down, which I feel like my breathing has improved so much better. It's just so many things that I just feel better about. I feel like my quality of life has improved drastically, and it's only been a month. And I'm like, I know this type of procedure it can be like 12 weeks recovery with internal recovery, but I'm so happy. My scar is coming along. My belly button doesn't even look like anything happened, so I still have my innie, and the scar is healing. I would say to definitely check out your website. Absolutely, there's lots of information. And although my preference was to work with Dr. McCool, I learned so much information from Dr. D. So big kudos to her for making those online video meetings, which were at least an hour long, extremely informative. So I had already learned so much about adenomyosis before I'd even gotten diagnosed with it, just because I wanted to it was very engaging. She answered questions. She made it very easy to understand. And I would suggest women learn. Don't look for a 5-minute video about a quick information tip of what an option is. Get the education, because it's available through your website on various platforms. So I would suggest they go there. Look at other people's stories for what they went through, what they chose, what they went through, what their experience was, and then look at people who did the dual port and see what their experience is like. And makes it a lot easier to consider what you think might work for you. I would want women to know that no matter how large your fibroids are or what condition you're dealing with in that area, that there is help for you, and that you're not limited to your doctor. When they say get a second opinion, that is just a gem of a statement. Get a second opinion, get a third opinion if you need to, and consider your options individually, and consider them all. But dual port is a great one to start there, and then see if anything else matches up to dual port, and then see what you come up with at the end. To me, with all the years of looking, all of the considerations, dual port was where I said, wow, this one looks too good to be true. I'm going to look at everything else. And if too good to be true can be possible, I'm here for it. This is your body. As a woman, this is your body, and you only have one. And, you have to consider what you're doing. It's like when you're rebuilding a house, they tell you measure twice, cut once, you know? So you want to make sure you're doing it right the first time. And just, it's better to know too much, you know, and not need some of the information you've acquired than to have any regrets that you didn't know something sooner and would have done something differently, or have an outcome that could have been prevented by your own choice if you were empowered, you know? So I appreciate being empowered